Healthcare providers have partnered to create a new data platform that will help deliver more personalized care and reduce health inequities in their communities. Welcome to Advancing Health, a podcast brought to you by the American Hospital Association. I'm Tom Hedderly, Executive Speechwriter for AHA. 14 organizations, including Providence Health System, Henry Ford Health System, Northwell, and others, have formed Truveta. The platform will de-identify the data and use AI to mine datasets, providing new insights into the unique needs of their patient populations. In this podcast, Doug Shaw, AHA Senior Vice President of Field Engagement, speaks with Rod Hochman, President and CEO of Providence and 2021 AHA Board Chair, and Terry Myerson, CEO of Truveta, about the platform and its possibilities.
Rod, Terry, thank you for joining us today. Really pleased to have you today and wanted to talk about Truveta. And with that, my first question to you, Terry, is health systems have tried for years to harness their data. What inspired the creation of Truveta, and why have so many other health systems joined in on this?
Well, I think probably the best way for me to answer that is reflect on how I came about being part of Truveta. For me personally, I was at Microsoft for 21 years, leading platforms like Windows and Xbox, and I left in 2018, and I always had this interest and curiosity in biology, and I joined a venture capital firm, became super interested in the innovation that was taking place at the intersection of data sciences and life sciences, really on the biotech side more than the healthcare side. And then it was March of this year when colleagues of mine from Microsoft who had joined Rod at Providence reached out to me and really invited me to be part of some of the work they were doing as part of the early COVID-19 response. And it was eye-opening for me to see the challenges they were facing in terms of asking and answering some really important questions. They knew physicians were using hydroxychloroquine in response to the early pandemic, but they weren't sure how was it going. There was no time for a clinical trial, so how quickly could they learn about the results? They'd heard about this idea that the loss of sense or loss of sense of smell was indicative of the disease, but trying to find that in the data, find the needles like that, find those patterns, it was too hard to do. And it was just eye-opening for me. And that's when I learned of this project, Truveta, that the Providence team and other teams had been working on for, frankly, a couple of years at that point. And I just came to this point of view that the world needed Truveta to exist, and if I was fortunate enough to be part of it, that would be great. But it was just so clear that there was no good way to quickly ask and answer questions, to learn from the data, in the clinical data. And that's, I think the pandemic just made it so obvious that the world needed a data system like this.
And Doug, I answer this a different way, and I'd answer it from the standpoint of having been on the healthcare side for 42 years and Mira, Terry being on the tech side, but, all of us in healthcare that are listening to this podcast know that there are certain things that have just bedeviled us on the healthcare side. And what's happened to us more than the pandemic also has been the growing frustration with tech, that tech felt we could take data, we could do this. And I think if you talk to all of our colleagues around the country in healthcare, they were kind of fed up with that and didn't feel the right things were going to be done. But the big problem for us on the healthcare side is that we needed people like Terry, who worked ran Windows. He's very humble about his career at Microsoft, but really understood the technical way of how to put data together, how to make the pieces come together, that I think is the part that people in healthcare didn't have. So we've been talking about this for 2 years, myself amongst healthcare executives, but then it takes a critical mass. I think COVID helped kind of push that effort, but this was something that was going to happen regardless of COVID. This was a natural consequence of healthcare getting its data together for good reasons, but also the spin on it being that maybe healthcare people that understand their patients and how to care for people were better stewards of the data, but they just needed a partnership with technology, and here's Terry. So that's how I think we see this coming down, and there's just, that's why there's been such enthusiasm amongst healthcare people.
Great. Rod, you mentioned COVID-19. In what ways has the pandemic influenced the Truveta concept and launch?
Well, I think Terry started it off beautifully because he gave a bunch of examples of the things the minute COVID hit, and actually the first case in the United States was January 20th. It wasn't in March, but that was the first case. It became very clear that we had to figure out what to do. So how did we do it? We did the old-fashioned way. We got on the telephone with people in China and in Italy and scrambled amongst all of ourselves and almost kind of put this all together. But as Terry said, can you imagine if we had Truveta, how quickly we'd be able to understand where the hotspots are, what are the other issues that are there, who's treating whom with what? Wow, it could make all the difference in the world. But then it just doesn't take a pandemic. How about health equity, or how about breast cancer? So there are so many ways that this could really do what we've been hoping to do for a long time as a group of healthcare people. So I think COVID was a great, good catalyst. If anyone had a doubt that getting together to put data together is actually how you can figure things out, I think COVID put the exclamation points. I don't know, Terry, you think?
No, I think that's right. I mean, for all that the infrastructure and questions we were asking ourselves, or dashboards that were being created for COVID, it was just sort of, again, eye-opening to think, what about every other human condition? What about pancreatic cancer? What about Parkinson's disease? What about rare diseases? There's this sort of depth of bespoke work being done for COVID, but the opportunity to think about health broadly, all human conditions, and build a platform that services all these questions, I just think it can just have a profound implication on all of us.
You acknowledge certainly the importance that it will have in dealing with these various clinical conditions. How important is it that Truveta will provide data to researchers addressing vulnerable and underserved populations in particular?
Well, I think that it's critical. I mean, that this whole issue around health equity makes it essential that we have a tool like Truveta. And talk about timing, right? So we've kind of rediscovered the health equity issue. Couldn't be a better time, right? Terry, what would you think? Right? Couldn't we answer those questions?
Well, I think the thing what Truveta can do is bring transparency to all those questions, such that when any question is answered, it is also answered in the context of the populations of the data. So in some ways, you could think of every data set that comes from Truveta having a data sheet that comes with it that says, this data represents these populations, and that's how that population varies against the broader US demographics. So there's no bias built into any analysis. Also, should anyone do some sort of detailed study within Truveta, we want we want every study being done with Truveta to be a health equity study. We want to be able to, always be able to differentiate on gender, always be able to see the data parsed out by ethnicity, just to bring transparency to what's going on in every single question that's being asked. And I just think that transparency will make us aware of biases and make us aware of inequities. And I think with that transparency, good people will take action. It's when we don't know the bias is there, and we don't know the inequity is there, it's much harder to take action. But we can provide that transparency now, every time.
And a big thing, Doug, with what makes Truveta unique is both the depth and diversity of the database. Because one of the things that we've struggled with is if we have a database with a whole bunch of suburban people from around the country, it's not going to answer the question. So one of the beauties of the Truveta database, which Terry can describe, but it goes from Alaska to New York, from Kodiak, Alaska to Texas. The diversity of the membership and the folks they represent is going to make it so important in terms of what the Truveta database looks like. So it's both the broad nature of the geographic diversity, the ethnicity, the racial diversity, but the other thing is the depth, because so many databases are like 1 inch thick, right? It's claims data from a healthcare company. It's a slice from CMS data. What Truveta does is it puts all of these databases together to create depth as well as the broad nature of it. But maybe Terry, a little bit more on how that database is put together.
Well, what we're talking about is the de-identified clinical data from these 14 health systems. Today it's 14 health systems. We certainly would welcome more, because the more data we have, the more diversity we get, the more you can more finely cohort the population and be able to study, any given cohort can have be population representative. So you can look at colors of skin and gender and sickle cell anemia with COVID. And if you want to be able to do that, then you need a very broad, very deep population that covers everyone. And so that's what there's so much complexity and interesting stuff behind this question, but we're talking about bringing together this de-identified data from across the United States from 14 health systems. And with that, we can create these very fine, very precise cohorts that are, accurately represent the population diversity of the United States. And with that, I think we're going to be able to learn some incredible things.
Regarding concerns about how the data may be used, what does Truveta mean by ethical innovation? And how important will the participation of other health systems be to Truveta's ongoing governance?
So I'll take that first, and then Rod can add. The first thing is the founding health systems put in place a ethics policy right up front. And the most clear thing in that ethics policy is the data is not to be used for selling and marketing to patients or physicians. This data is to be used to improve care, to develop new therapies to improve care. But this is not about personalized advertising. This is not about personalized marketing. It's about improving the lives of patients and improving the communities we live in. That ethics policy then is maintained by a standing committee of ethicists from these health systems that we're reviewing ongoing the research use cases that the data will be used for. My board of directors does consist of health systems. So I work for the health systems. Health systems representatives govern the use of the data. And for us, we have put this very clear line in the sand on ethical innovation to say this data is going to be used to improve care. It's not to use to market to you, which, ironically speaking, as a technologist or engineer, the people we're hiring into Truveta right now, if you were a big data engineer, you've been spending your career for the last 20 years learning how to run more personalized advertising. That is what that's what the best engineers in the world have been doing for the last 20 years, is selling ads to you. Now, to be able to use those skills, but to save lives with data, to improve the health of our communities, it's just an amazing mission for us to be attracting talent with. But that's what we mean by ethical innovation. We specifically say this is about patient care and developing new therapies for patients, not about personalized advertising. And then we put in place this ongoing governance of an ethics committee and of a board of directors.
And we've always said, and I think health systems see their partnership with patients and families as the most important relationship we have. And for a long time and forever, patients have trusted us with their information, with what they do, and they trust their doctors, their nurses, and their hospitals to be able to do that. So myself and my colleagues that have been part of Truveta see that as first and foremost. And Terry has had to deal with all of us and all of our, folks, but the dialogue has been so rich. And that's one of the benefits in Truveta, is that the health systems together collectively have put their best ideas forward with the Truveta team to really come up with the best concept. So whether it's data security, whether it's how data is used, we've really built those things in, which makes it truly unique. And it's not just one health system deciding how to do it. It's really a collective energy of all of these health systems together to figure some of this out. And what we're most excited is how amazing is it to get our data scientists from all these health systems working together on a problem. And, it was COVID, but it could be anything else. But we've never had a touch-based place where you could get all of those data scientists together from all these different systems working on a common problem. So Truveta really provides that nucleus to be able to do that, which is, I think it's exciting for us, it's exciting for our patients, and kind of discovery as we move forward.
Terry, you mentioned a few minutes ago the importance of building diversity in the data. Rod, you were just talking about how now through Truveta, data scientists across multiple provider organizations will be able to work together in ways they haven't. What are some other ways that Truveta will provide a unique opportunity with regard to data collaboration?
So you have a data set that represents 13% of all clinical care across 40 states in the US. So we got the depth, diversity, scale of the data. We then have the fact that the purpose of this data set is to do good for patients, not sell and market to them. So those are all unique things about Truveta. But then also, Rod referred to this, since all of the members share a common schema for this data, they're going to be able to have this collaboration across them. So you'll be able to ask a question within the Providence system and find a pattern. You'll then be able to take that same query and ask that same question within the Northwell system or within the Trinity system or within the Baptist Health System and saying, are you seeing the same thing as me? That query portability has never been possible before by the member systems. So enabling that collaboration between health systems, I think will create this learning loop faster than ever before.
Rod, how does the Truveta business model support and encourage participation by other health systems? Already there are 14, and we speak of maybe more joining. So how does that work?
So I'll start and then I'll hand it to Terry. But we've really, this is about a collective effort. So it wasn't about one system trying to figure out how to do this all on their own and not welcoming in other partners. So that was really critical in the design, that ownership of Truveta be amongst many parties. And we're going through getting the initial membership set, but our hope is really to welcome as many health systems as we possibly can into the fold here. And as we get inquiries to look at that. But then also, as you know, Doug, we've been thinking about how do we get smaller members out there so that they can be part of this. And I think we've talked with the American Hospital Association about bundling perhaps some of our rural hospitals together. So, because we really want to make this something that is as relevant for a small hospital in Missouri as it is for a large health system on the West Coast or East Coast. So, Terry, maybe some of the things that you've been working on, because I know you've been dealing with the folks we've been sending your way about how to get that organized.
Well, we absolutely would welcome health systems across the United States, and I think in the we're not ready for it tomorrow, but I do think globally, even I think the idea that health systems can be learning from each other and shorten that learning loop and enable them to be able to understand things they're seeing, share with others. I think that's critical, and to bring that sort of expertise of what's working and what's not to every clinician everywhere in the world, that's what we would like to do. And so we love the 14 partners we have today are just terrific. But I do look forward to more joining us soon.
So, Rod, in closing, and taking advantage of that call to everyone listening to participate, what are some of the most compelling use cases that Truveta will be able to address?
Right. I'll start out, and then I'll hand it to Terry. But the ones that clearly are top of mind for us, obviously, are how do we better deal with a pandemic like COVID, right? So how do we predict where we're going to have problems? How do we predict what demand surge will be? And this having Truveta will help us do that. So that one's kind of, I think people get that one pretty quickly because we've dealt with it. The second one, which we've talked a little bit about, is just the whole issue of the problem we've been staring at about health equity. And health equity in cancer, in the way we treat other diseases, we've been staring at that issue, but we haven't done anything about it. We need to have great data to really help us kind of be able to see, are we making progress? Breast cancer, particularly in the African American community, is one that I think is really ripe to kind of dig in. The whole issue that we've talked about at the AHA around maternal and fetal mortality and the differences based sometimes on zip codes, sometimes on different factors. But if we could really dig in and understand why those issues are there. And then the other are the scientific nature. Look, as we follow COVID out or other diseases, we don't know what we don't know. And having Truveta will enable us to understand what are those things that we're missing that oftentimes painfully take us years and years and years to put the pieces together. And this will shorten the cycle time. But Terry, you have some other things that you've been looking at too.
Yeah, I mean, related to that last example, Rod, when we look at the challenge of rare disease diagnosis and the journey that families go through today, spending multiple years seeking that subject matter expert that can recognize the pattern of symptoms and lab tests to say, this is the rare disease which your child or family member has. We can help so much with that by basically, that's a search engine problem. That's taking a sparse set of data and then putting it up against patterns of thousands of known diseases. It's not reasonable to expect any one clinician to know all 10,000 rare diseases, but a computer can keep track of all those things, and it can help diagnose and create a much better patient experience. And along those, another thing we're seeing a lot of passion from our early members is around care variation research, or doing comparative effectiveness studies of, in certain instances, which of these drugs have better outcomes. Those are hard questions to ask and answer today. There's obviously very slow, expensive clinical trials, but all the time we're learning that there's these very specific questions that are being asked about this drug or this drug in this circumstance, which has better outcomes for the patient. And we have the data. It's in this Truveta data set, and we should be able to ask and answer those questions so much faster than ever before, which is quite exciting in terms of improving the patient experience.
The way I look at this, Doug, as we're closing up here, is Truveta is like the Hubble telescope in opening up the universe and opening up the aperture to really understand what's actually been right in front of us all the time, but we haven't been able to see it. And I think this marriage of some of the best technology people in the world that Terry's put together and that whole group with some of the best healthcare people in the world, that marriage is going to create something that truly, I think, is, at least for Terry and I, it's the thing we're probably the most excited about as we kind of look forward and go into the future.
That's wonderful. And that's a great way to describe what Truveta is. Terry Myerson, Rod Hochman, I want to thank you again for taking time today to share more about Truveta. I'm sure there are many in the audience listening who will want more information. Where should they go?
Terry?
Truveta.com.
Great. Thanks again, gentlemen. Take care.
All right. Thank you.